Good morning, everyone. I'm Dr. Anil, surgical oncologist, Prathima Hospital, and I thank everyone, Dr. Avinash sir, Dr. Rahul sir, and Pratik sir for giving me this opportunity. Today is World Cancer Day. So this was started in 2008, and every new year they'll start a new theme. And this year's is Close the Care Gap. Relatively, I want to speak a few words regarding cancer vaccines. Like two vaccines are available to prevent cancers. That is one for HPV, human papillomavirus, and second is HBsAg, that is hepatitis B virus. So these vaccines are used for prevention of cancer, and the treatment of the cancer starts from preventing the cancer itself. It begins with the cancer vaccines, that is prevention by giving HPV virus, that for all the boys and girls starts from 9 to 14 years start taking these vaccines. It's available as bivalent and quadrivalent vaccines, and these vaccines can be given up to 45 years. So these cancer vaccines will prevent HPV virus, which enters the cervical cells, and it can prevent genital warts also and cervical cancer also. So it is preventive against vaginal vulvar cancers and genital cancers for males and females. So try to get vaccines as early as possible before sexual intercourse. And as you know, this hepatitis B virus is also a major cause. Screening for breast cancer from 35 to 40 years of age group. Every yearly mammogram is a must for all the women. And for high-risk women, as Avinash sir told, it should be breast clinical examination as well as self-examination every weekly, and every 3 monthly clinical examination is a must for high-risk clinical women. So these cancers can be hereditary as well as sporadic. Hereditary or less common, breast cancer; sporadic or more common. So mammogram is a must for all the women after 35 to 40 years of age group. So second is for cervical cancer, pap smear. It should be done every yearly initially. If it is negative, every three yearly. It should be done after 45 years of age group. Another one more silent cancer is ovarian cancer, which I think no one has spoken about. We should be for this cancer, every individual after 45 years should get an ultrasound abdomen and pelvis every yearly. And if there are any complex or malignant ovarian cysts, it should be screened every yearly, and along with a tumor marker called CA125. So ovarian cancer is one of the silent cancer which we should be aware of. And other most common cancers are head and neck cancers. Tobacco is one of the most common leading carcinogenic agent, and around 10 lakh patients or persons die due to tobacco every year worldwide. So it should be avoided at any cost. Along with it, after this oral cancers, the most common cancer would be the endometrial cancer and lung cancer, which who is a chronic smoker, who consumes tobacco, should get their annual CT, low dose CT, which is less carcinogenic. Not much of malignancy is attributed to it. Should get their CT done every yearly. So finally, prevention is always better than cure. Start screening yourself and take vaccines properly. And stage and the diagnosis of the disease, all the treatment of the cancers depends on the stage of the disease. For all the patients, not chemotherapy is indicated. Initially, for depending on the stage of the disease, stage 1 and stage 2, we try to operate. If it is locally advanced disease, we try to give chemo and we'll operate next. And adjuvant radiation will follow if there are any margin positive or it's any aggressive tumor. So stage-wise treatment will be there for all the cancer patients, and it's not a single chemo or medical. It's cancer treatment is a teamwork, and everyone has their own importance. Thank everyone for giving me this opportunity, and I won't bore you for long. Thank you.